my concern is very clear that 15 to 25% is not just a small way, it's a big positive thought. Moving from natural to IUI, we are trying to increase the growth of the eggs by 2 to 3. If I make all the eggs to grow, imagine the outcome. It will end up in multiple pregnancies, which is more deadly. So what is understanding a cumulative IUI success? Thereby sometimes you are getting the follicular recruitment, follicular growth till the end. Rupturing is happening, egg is getting released, but after inserting the sperms, why the results are not coming? Maybe because of this. I feel really happy for myself. My speech has really given a lot of transformation. It's a lot of given awareness and clarity for you. So now we are into the fifth part of no IUI, no IVF ICSI. No IUI, end to end, it ends with success. So what is this fifth part is like IUI stimulation. Like the last 4 topics probably may be connected to the couples, right? IUI success, IUI cost, IUI steps and IUI preparation, right? Now we are in the fifth topic, IUI stimulation. So this stimulation comes from the clinician side. So we have to really give our inputs to you, give that clarity. So if you see from the beginning I was telling you the IUI success goes with 15 to 25% and 25 to 35% in accumulated cycles. When you do it a cumulative cycles, right? That means it is between 15 to 35%. And I was telling you in the beginning itself, if you use only tablets to grow the eggs, you will have 15%. Tablets with hormone injection, it's 20%. Only hormone injection, it is 25%. So why it is this degrading? As a couple, you have every way to ask me why that success can be 25% in tablets itself. So it's a very genuine doubt you can ask me. So for that, this topic will give that clarity for you. So my concern is very clear that 15 to 25% is not just a small way, it's a big positive thought. You are getting into success. So you are increasing your success positivity. So it's not a very simple percentage as what we think in a lighter fashion. Okay. So now if you understand, there are 2 tablets is being used for this IUI stimulation. As we mentioned the process, we understood naturally only from both the ovaries, out of which 5 to 6 follicles is being generated in the particular month. From both the ovaries, it will be around 10 to 12 follicles, of which only 1 follicle from either of the ovary only will grow. But here, we want to improve the success. I mean, we want to go to the next level. Moving from natural to IUI, we are trying to increase the growth of the eggs by 2 to 3. Why we are not make it 10 to 12? Why we are not allowing all the follicles to grow by giving higher dose of medications or injections is like we need to have a logic. Here we are going to prepare the husband's semen and extract the active motile sperms and inject that sperm only into the uterus. So the fertilization process is going to take place inside. If I make all the eggs to grow, imagine the outcome. It will end up in multiple pregnancies, which is more dreaded, and it is not advisable. So we need to terminate that pregnancy, so which is not indicated. So our motion is, our indication is, our thought process is, I need to grow at least 2 to 3 follicles. To that amount, I am giving tablets and injections. It's very clear. So now let's go to the tablets. There are 2 tablets is being administered here. One is called the Clomiphene citrate and other one is called the Letrozole. Okay, so what are the difference between these 2 tablets? Earlier the days, the Clomiphene citrate was used. So most of the clinicians to start with, they start with 50 milligram or 100 milligram, but they are stepping the dose to 150, 200 milligram in the subsequent cycles. Say for example, if they start with 50 or 100 milligram, they will start follicular recruitment. One follicle will grow, but it will not grow to the end. It will not get ruptured. So this is the observation in the first cycle. So what happens is, the clinician will step up the dose from 50 to 100 or 150 to 200 in the second or third month. So what is the understanding here? Cumulative IUI success. You got it? Why we are recommending to go for successive IUI in second or third attempt by improving the successes? This is the reason. Okay, so the properties, Clomiphene citrate is something like it is growing 1 or 2 follicle extra. Okay, fine, I'm growing. But what is the negative here? Why this tablets is giving less success rates compared to only hormone injection is this Clomiphene citrate by property it's called anti-estrogenic. Anti-estrogenic, why? Anti-estrogenic means what is that negative effect? Have you heard of this endometrium? The inner wall of the uterus. The endometrium is that one inner layer which receives the uterus, which receives the embryo and allows it to get implanted, attached there. The endometrium is the place where the embryo go and get fixed, implanted. So the endometrium is the soil for the seed to the sower. So in the same way, for the embryo to go and get implanted, the endometrium is needed. For the endometrium to grow, estrogen is needed. So when this estrogen is anti-estrogenic in Clomiphene, though it is allowing us to grow 1 or 2 follicles extra, but it is having a negative influence in the inner layer of the uterus, the so-called endometrium. So it is against endometrium. Thereby sometimes you are getting the follicular recruitment, follicular growth till the end. Rupturing is happening, egg is getting released. But after inserting the sperms, why the results are not coming? Maybe because of the unfavorable endometrium. Have you got the understanding? Why there is a difference in the tablets and the injections in terms of success? So there is one other injection, tablets has been used to call Letrozole, which is given the dose of 2.55, 7.5 mg. So this Clomiphene and Letrozole, these are 2 separate medications. A broad understanding is Clomiphene is multifollicular. Letrozole is monofollicular. If you increase the Letrozole also, most of the time it ends in singleton pregnancy. But when you use Clomiphene, it ends in multiple pregnancy, twins or triplets. So this Letrozole has less negative effect in the endometrium compared to the Clomiphene. Now you understood why Letrozole is being given, and some women, when we give Clomiphene, their response to the endometrium is unfavorable. So in that women, we can try Letrozole. So see how we have to have that closed monitoring, closed observation and closed care when a woman is coming for IUI stimulation and IUI treatments. So this is how we have to do a team effort. As a couple, you have to put your efforts from your end, and as a clinician, I have to put the efforts from my end to make sure it is a success and a healthy baby. Okay, so it's like a teamwork. So the embryologist, the clinician, the paramedical staff, both the male and female partner, all of them should put their collective efforts, and that collective efforts will end in the success. So now we have understood Clomiphene and Letrozole. Now let's come to that injection. That injection is called either HMG, human menopausal gonadotrophin, or FSH. So this FSH or HMG. Okay, so what are we going to do? When this HMG or FSH, some clinicians has their own preference to use one of these 2 injections. Among FSH, I have given very elaborately in the part 4 of IVF ICSI speech. What is the type of FSH? Urinary FSH, highly purified FSH, recombinant FSH. Am I right? So these 3 type of FSH goes with the type of manufacturing standards and pricing difference. But I've told very clearly, now the so-called the best FSH is recombinant FSH in terms of precision, in terms of removal of impurities and marketing stringent standards, manufacturing stringent standards. So the same recombinant FSH after manufacturing in India, we are removing that import cost and everything and other logistics. That recombinant FSH is now become the cost of urinary FSH. So let's remove that headache. Even you can try this recombinant FSH. So no need to be thinking of this urinary FSH or highly purified FSH for the sake of cost, even because we are going to give low doses only. So it's not a big difference going to happen. As we thought, it's like between 5,000 to 15,000, but still every penny makes importance in terms of clients who are having financial challenges. That also we'll keep in consideration. Now understood, there are two types of tablets and two types of hormone injections being used for the stimulation in IUI, and what are the tablets and what are the injections and how it is being administered, and what are the benefits and what are all the challenges and what is the price difference. So this is the clarity I want to give you, because it can be a positive, no problem. If it is a negative, you should know what is the tablet given, what is the dose given, what is the number of follicle grown, how many follicle ruptured at the end, and how many what is the endometrium thickness at the end. So when you understand all these inputs, I feel really happy for myself. My speech has really given lot of transformation. It's lot of given awareness and clarity for you. The couples, you should have an understanding. Instead of blaming the doctors or the paramedical staff, if the doctors were transparent and they really put their efforts, and in the first cycle to second cycle and second cycle to third cycle, they are ending with the unexpected follicular growth or lack of rupture of the follicle or unfavorable endometrium, what a clinician can do. So it's all with the, you are now trying to have a synchronization, alignment. You are getting that understanding. Okay, my endometrium is resistant. Okay, my follicular is not growing till the end. Okay, my follicle is not rupturing. What is that made me to end in failure in IUI? Forget the failure. Understand the reason for failure. That is the stepping stone for a success in the future. This is what the depth of understanding and clarity and awareness. When you are having that awareness, you will ensure that you will prepare yourself, you will give your full cooperation, you will align with the team of doctors who are treating you. So now we have that clarity. No IUI, no IVF ICSI. No IUI, end to end with success. So if you have undergone all these experiments in this IUI itself, imagine what the way you will end up in IVF or ICSI. Even in this IUI itself, I want it to be with success. That is why end with success I have mentioned in IUI itself. Okay, so GSSSS is nothing but IC. Infertility ends in conception. IC, positivity, pregnancy and parenthood. Looking forward in the 6th part. Good day.